migraine. The mechanisms of acupuncture. Migraine is ranked as the third most common disease worldwide, with an estimated prevalence of 14.7% globally. Over 4.9 million suffer from the condition just in Australia. The condition is so severe that the World Health Organization equivalates severe migraine attacks to diseases such as dementia, active psychosis and quadriplegia, and ranks the condition as the 7th most disabling disease worldwide. According to the Deloitte Access Economics Report, the indirect and direct costs incurred by migraine disorders in Australia alone amounts to $35.7 billion per annum. The effects of migraine can be so severe that simple things such as driving a car, concentrating and sleeping can become complex and severely impact family life and employment opportunities. Incidences of anxiety and depression are more common in sufferers of migraine, and a study conducted in 2013 by the Global Burden of Disease found that migraine alone is the 6th highest cause of years lost due to disability globally. But what's the difference between a headache and a migraine? A headache is a very common condition that almost everyone will experience at some stage in their life. Headaches cause mild pressure and aching in the muscles of the head and usually last from 30 minutes to a couple of hours. A migraine, however, is a neurological condition that can cause severe headaches that can last from 4 to 72 hours in duration. The International Headache Society diagnoses a headache as a migraine when the pain is one-sided, moderate to severe in nature, throbbing and aggravated by movement. There also must be at least one of the associated symptoms, such as vomiting, nausea, or sensitivity to light, smell or noise. An aura often accompanies migraine attacks for many sufferers. An aura is a sensory disturbance that can occur prior to or with the onset of a migraine. It's also common to experience a number of symptoms up to 24 hours before the onset of a migraine, including changes in mood and appetite, and excessive yawning and drowsiness. The mechanisms behind the cause of a migraine are not yet fully understood. In historic times, a migraine was thought to be caused by spirits, and it was treated through trepanning, a surgical procedure that involves drilling a hole into the skull to release evil spirits. Luckily, today's understanding and treatment is far less barbaric. There are several hypotheses for the mechanisms of a migraine. One theory involves the activation of afferent nociceptive pathways within the trigeminal nerve fibers, spinal trigeminal nucleus, and the thalamus. Upon activation, peptides such as calcitonin gene-related peptide and substance P cause neurogenic inflammation, mast cell degranulation, and the release of inflammatory mediators such as serotonin, noradrenaline, histamine, and prostaglandins. These neurotransmitters stimulate the nociceptive nerve fibers and activate the trigeminal nuclei, causing a rapid increase in blood flow to the meningeal blood vessels and cerebral vessels that cause migraine pain. There are limited treatment options available, and the current treatment is aimed at reducing the pain and the prevention of the migraine attacks altogether. Over-the-counter and prescription medications such as aspirin, paracetamol, and anti-inflammatory drugs are available. However, they often do not provide relief and cause unwanted side effects such as dizziness, muscle weakness, and nausea. Due to this, many people have turned to alternative therapies such as acupuncture. Acupuncture is a Chinese medicine modality that inserts thin needles into specific locations on the body called acupuncture points. Many points are chosen based on Chinese medicine principles of energy or qi redistribution throughout the channels that circulate the body. The basic theory underpinning Chinese medicine is based on the concept that if there is free flow, there is no pain. If there is pain, there is a lack of free flow, meaning that blockages or stagnation of the body's qi is responsible for migraine pain. Many things in Chinese medicine can cause qi stagnation, such as external pathogens of wind cold, wind heat, and wind dampness, or internal pathological substances such as dampness, phlegm, and the stagnation of blood. All of these factors block the qi of the channel and cause pain. Acupuncture for migraine is thought to influence the body's qi, remove stagnation, and regulate the flow of qi in the channels of the head to reduce migraine pain. But how exactly does acupuncture work from a biomedical perspective? Several clinical trials have investigated the mechanisms underpinning the use of acupuncture for migraine pain. A study conducted in 2001 and published in the World Journal of Acupuncture observed the effect of acupuncture on calcitonin gene-related peptide, or CGRP. 186 participants were randomized into two groups, an acupuncture or medication group. Acupuncture was given on points such as liver 3, liver 2, gallbladder 20, and gallbladder 34. The medication group were prescribed 3 different drugs. The levels of plasma CGRP were measured using radioimmunoassay, and the study found that acupuncture significantly lowered CGRP levels after treatment. The study showed that acupuncture decreases plasma CGRP, which stops the activation of the trigeminal nerve and dilation of the cerebral vessels, which may relieve migraine pain. Another study published in the Journal of Experimental Medicine identified the effects of acupuncture on serotonin and dopamine in rats. A large amount of neurons in the trigeminal ganglia are serotonergic, and it's hypothesized that increased levels of serotonin may prevent migraine attacks through vasoconstriction. 24 adult rats were split into two groups. One received acupuncture on bladder 23 and the other received sham acupuncture. The levels of serotonin was measured through cerebrospinal fluid by a brain probe which was placed in the nucleus accumbens. Results found that acupuncture at bladder 23 increased the release of serotonin 20 minutes after acupuncture and continued to rise 40 minutes after treatment. Although this study was conducted on rats, the study provides evidence that demonstrates that acupuncture may increase the levels of serotonin and reduce migraine severity. Another study observed the association between acupuncture and brain metabolite changes in N-acetyl aspartate and creatine through proton magnetic resonance spectroscopy imaging. N-acetyl aspartate is a marker of normal neuronal mitochondria activity, so a decrease in this brain metabolite usually indicates a mitochondrial dysfunction. The study took 186 participants and divided them into three groups: a migraine without aura group, a cervicogenic headache group, and healthy control subjects. The migraine group and headache groups received Biram acupuncture at the points governor vessel 20, gallbladder 20, and liver 2, while the control subjects received sham acupuncture at non-acupuncture points. Headache intensity was measured using the visual analog scale and included headache frequency and number of headaches. The pain scores were correlated with the MRSI imaging at baseline and post 5 weeks of treatment. The results showed that acupuncture in migraine patients without aura had a significant decrease in the mean headache intensity score. Interestingly, there was an increase in the levels of N-acetyl aspartate and creatine across all three treatment groups. There was a significant correlation between the level of N-acetyl aspartate and creatine and pain scores, which was observed at baseline and post-treatment. This study represents one of the first to use MRSI to investigate the effect of acupuncture for migraine patients and the relationship between pain and brain metabolites. The study shows that the mechanism of acupuncture in migraine is due to the increase in the levels of N-acetyl aspartate, which helps restore neuronal activity in the thalamus through mediating pain receptor modulation. To this date, the biomedical causes of migraine are still not completely understood, and it can be difficult to find quality research that investigates the mechanisms of acupuncture for the treatment of migraine that uses biomedical markers. Even so, the three studies demonstrate some key underlying mechanisms of acupuncture for migraine, such as lowering calcitonin gene-related peptide, increasing serotonin for cerebral vasoconstriction, and increasing the levels of N-acetyl aspartate that may restore neuronal activity and modulate nociception. And with this information, the world is a little more closer at understanding the causes and treatment of migraine, and providing solid evidence that supports the use of acupuncture for the treatment of migraine pain.